3 months and I set everything up, and now none of these want to connect anymore anyway.
Right, so that's a hard wire or sneak back here.
Well, that's like I did before, but then you have to cable run behind everybody and they almost tripped, and it's like, why not? This one's good. Yeah, I'll just put it up here and see that the timer's counting down.
You're only gonna give me 2 minutes, right?
And you're officially at 5 o'clock.
All right, I'm gonna now call the meeting to order at 5 p.m. Please rise and join me in the Pledge of Allegiance. I pledge allegiance
To the flag of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right, declaration of quorum. We have 4 members today. Ashley Jones is absent, so we have a quorum. Regarding the agenda, we're going to have a couple changes to it as printed. After item 3, we will discuss the HB 110 audit findings. And then I suggest we move the executive session, item 7.04, below the public comment session. Does that sound all right with everyone?
Yeah.
Okay. Certification of delivery of official notices of meetings, Adam.
Yep, that was given.
Okay. Regarding the meeting minutes for the special meeting held on March 15th, 2023, it is my suggestion that we table that motion and have the new employee
Yes.
handle those instead. I did not think that they were up to the standard of professionalism that we want to see, and there was just a lot of inaccuracies. So I would just request that she watch that video and provide a different set of meeting minutes. So I'll entertain a motion to table approval of the special meeting of March 15th, 2023.
I move to table approval of the special meeting minutes for March 15, 2023.
I'll second.
All in favor?
Aye.
Aye. Opposed? And that motion carries.
Any abstentions?
Oh.
I don't know if you want to approve that or not, Dr. Jenners.
You weren't there. I wasn't there.
It's up
Well,
to you.
you were there actually, just on the different
Yeah.
side of the table.
Yeah.
That wasn't.
You can
You were
vote
not,
yes.
you were not
I
a
want to
board,
make sure you have
you
the
were not a
option.
board member at the time.
It's up to you.
It's just motion
Yeah.
to table as well. It was not approval of the minutes.
He votes yea, I think.
Yeah.
What he tells me.
Okay, all right, very good. Any comments on the March 22nd regular meeting minutes? I, of course, have some, but I will let others go first if they would prefer.
Well, since they're a new format, it took a while. I'm not gonna disagree with anything that's in here. I did read them, as long as I now understand that the notes are not part of the, are not part of the minutes. They're filed with the packet, but not part of the minutes. Is that correct?
No, the whole packet goes on will go on the website. So that includes the reports that can, well, there are no committee reports, but there are committee reports. So the goal is that if a layperson were to look at that, they could easily determine like what the directors provided, what the health commission provided, including the numbers. In the past, it's been a little bit more condensed. So we're going to give them, in essence, what all of you get will go on the board or on the website as well. It is a new format. It's a little more, the header's a little bit more clearly defined, and then you have more of a break between the different departments as well. So you can see where, like, as an example, where nursing ends and EH begins. It's a little more defined in there.
The document's public record, but the meeting minutes are separate into the other supplemental staff reports, which are still public records. It's easier to
Okay.
provide education.
Thank you for the further explanation. The only other thing that I would say at this point is that executive session is 7.07, and that really came after the citizens' remarks that are 8.0.
I would that as well.
I would
Yeah.
flip that.
You can do that.
Yeah, I guess I had one question about this. I noticed that for the votes, not everyone is listed, just if someone abstained, and whether whether, you know, who made the motion, who seconded, if the motion was carried, and then who was abstained, and there wasn't individual.
Yes, you don't have to do the
Okay.
individual, we can if you would like though.
I don't have a strong preference, I just wanted to make sure that that was, in compliance.
Well, many times when we vote, we just say and nay, and we don't do it individually.
That's fair, I don't roll call.
And that's why
vote.
usually the first
We
and
don't do
second
it.
matters, because that is who actually
Right.
say, yes, I want to bring it to vote, and obviously discussion that would ensue afterwards.
Okay, that's fine with me. Page 6, under 4.01, discussion, it says Ashley Jones asked who the community needs assessment was presented to. That was actually me that asked that question,
Okay.
which is why I know it was wrong. And then the other thing I noticed on page 9 regarding the election of Board of Health President and President Pro Tem, I believe we did that at the start of the meeting. Is that your recollection as well, then?
It wasn't the first thing on the agenda. It did happen after.
Right. I agree.
Which page was that, sorry?
Page 9. I mean, it was definitely,
It was after the minutes.
Oh, it was?
It was
Okay.
after the minutes, yes.
Yeah, I think we did the finances as normal, and then we jumped into that. I'd have to look at the video though. Yeah, that tracks
Okay.
over.
I would look at the video. I know it wasn't the first thing, but I do know that it was not probably as far back.
Okay. That was just, and quite frankly, I wasn't sure when it was done, I just thought it was done earlier. And then finally, just on page 12, citizens remark that apostrophe should come after the house,
Okay.
since there were more than one citizen. Okay, I'll now entertain a motion to approve the regular meeting minutes of March 22nd, 2023.
With the noted changes.
Oh, yes, as amended, correct.
So moved.
Second.
Any discussion? No? Okay, all in favor?
Aye.
Aye. Opposed? Any abstentions? That motion carries. All right, we'll now discuss the HB 110 audit findings. Mr. Kister, if you wanna bring the report.
Thank you, board. Where would be a good spot for me so that I can,
Yeah.
best over here?
Yeah, why don't
Yeah.
we?
You mind if I?
No, absolutely.
Sure, I won't come tomorrow. Members of the board, ladies and gentlemen, McDonald Hopkins was asked to examine the financial records, the inspection forms, various electronic databases, and the public records of Geauga Public Health to provide information on the implementation of House Bill 110. Now, what is House Bill 110? I know there's a lot of questions out there. Well, in 1984, the Ohio General Assembly adopted House Bill 110, which created a framework for a partnership between the Ohio EPA and local health districts. This allowed local health districts to oversee and inspect small commercial sanitary and disposal systems. So this program allows the Ohio EPA to enter into a contractual relationship whereby the local health districts conduct on behalf of the Ohio EPA inspections and enforcement services for commercial sanitary waste treatment disposal systems discharging less than 25,000 gallons per day. And this program became commonly known as HB 110. Now, there are various examples of what HB 110 includes, and these systems including things like restaurants, small mobile home parks, businesses, industrial parks, housing subdivisions, apartment complexes, markets, shopping centers. I mean, the list goes on, but generally it's commercial, it's usually smaller in nature. It isn't, like a large city program, okay? But there's two main types of systems that this reviews. It is the off-lot discharge system and the on-site disposal treatment systems. Local health departments provide inspections every 3 years for the on-site non-discharging systems and yearly for the off-site discharging systems. Now remember, any violations or issues as it relates to enforcement are done through the Ohio EPA and your local prosecutor's office. So what was the purpose of this review? The audit provides Geauga County Board of Health a full picture of the number of fees paid for the House Bill 110 applications and the number of applications and inspections documented in the 3 informational systems that Geauga Public Health has from 2010 through 2022. This information can be used by this Board of Health, the administrator, the health commissioner, to determine if there are any deficiencies, and if there were any deficiencies, how to remediate those issues. So what was the scope of review? This audit consisted of 5 specific phases. Okay? Phase 1, it was an audit of the manual audit of the hard copy files. Okay? The purpose of that review was to look for inspection applications, fees paid, documentation substantiating completed inspections from 2010 through 2022, and to confirm that all of that documentation was in the hard copy file itself. Phase 2 was a review of a on-site database. So we had auditors here on-site reviewing each record in the on-site database. In that database, you were going to find things like addresses, names, inspection dates, and the auditors then cross-checked what they found in the hard copy files against what they found in database 1. Phase 3 was the review and audit of an off-site system, and we're just going to call this one colloquially database 2 because it was easier that way. And there were roughly 870 separate records in database 2. So in the hard copy files, we had well over 1,000. In database 1, we had 470. In database 2, we had 870. And what we looked for again was inspection applications, fees paid, and documents substantiating completed inspections. Okay? So that brings us to phase 4. What do we do with all of that information? This was our chance at this point in time is to look at the scope of information that we had and cross-check it against each other. So if something was in database 1 but wasn't in database 2, then nothing corroborated. Then we checked it against database 3 to see if we had corroborating information. And we did this for each and every address that was out there. Okay? And what did we find? Well, unfortunately, we found a lot of holes. And so the next part of the investigation and part of the audit was we had to find where did the money go. And what we then looked to was the fee sheet. There's a House Bill 110 fee sheet, which is basically, it's the general ledger. Let's just call it the general ledger of GPH. So we know that this is accurate because this is the dollars and cents coming in the door to GPH, and that money is then going to the county auditor. So we know this money, there's a trail, and you can track it, and we know it was accurate. So then we started to fill in based upon the addresses for which the fees were brought in, and we were able to put that in our overall report. So what did we find? And I know that's the big question here. Well, for the periods of 2010 through 2022, we were able to determine that GPH accepted $791,084 in application fees and late fees. House Bill 110 fees collected involved 577 separate property addresses. From 2010 through 2022, there were only 203 inspections done. And I will tell you that 97 of those inspections, they happened in 2022 when GPH staff recognized that there was a deficiency and tried to address it immediately. So once it was identified, 97 inspections of those 203 inspections happened that year. So when we started looking at those 203 verified inspections that happened, we were able to credit the county, or credit GPH, I should say, with $33,172 in fees paid and late fees paid, okay? Thus, there was a net payment that were received in and no inspections conducted in the amount of $757,912. Which leads us now to, well, how does this happen? What were the program deficiencies? How do we address that? And that was the second part of our audit. So, what were the deficiencies outside of the fact that the inspections just weren't being done? Well, let's look at the database sources. Let's look at the informational sources that we based the audit on. The hard copy files, database 1 and database 2, okay? So as I said before, the hard copy files, there were over 1,000 different files. And we had some organizational issues here, let's just say that. The files themselves weren't in any chronological order. Many of the files had information from other addresses. The documentations in the file weren't consistent. So you had things like 123 East Washington Street, and you might have information in that file that might be 321 East Washington Street. Or you might have transposed addresses. And that transposed address might have, for example, let's just say it is 123 East Washington Street, and someone didn't find that when they went through, or maybe they didn't even search for the hard copy file. They just created a new one and accidentally transposed the address. So now, as opposed to 123 East Washington, they made it 321 East Washington. But you have the information for 123 East Washington in there. So what we were able to do is go through each and every file. And we were able to pull that information out, and we were able to put it in our documentation to substantiate that there was an application, that a fee was paid, and whether or not an inspection occurred. The other thing I want to talk about is file control. And we were able to determine that there was a lack of file control and security measures in place. And it's something that in our recommendation to the board here today, that's one of the things that you're going to have to address. And the reason I say that is because we have auditors here on one specific evening in which they went through a series of shelves. And we know that those documents were audited. We have documentation that those addresses were covered. And then we came back the next day and a portion of those records were gone. We don't know where they went, but what we can tell you is that they never came back during the audit period.
Could you repeat that?
I can tell you that we had audited a section of the shelf, and so that section we know is done. We came back the next day, and a portion of those records were gone. We can't tell you where they went, but we can tell you they were previously audited, because we had records for them. But when we got back, that section of files were gone. We don't know where they went, and we can't tell you if they ever came back, but during the audit section, while we were reviewing the hard copy files, they did not reappear. That's something that we're going to have to address. Number 2, database number 1. Now remember, we had over 1,000 hard copy files, but when we moved to then start looking at database 1, there were only 471 records in database 1. So now we've got a huge disparity in addresses, how they were maintained, and what was put in database 1 in comparison to what was in a hard copy file. Now I will tell you that database 1 was helpful in the fact that you could fill in the blanks. It had some very helpful fields that you would fill in, like name, address, whether or not an inspection date appeared. Now I will tell you that for many of the addresses an inspection date did not appear, which is why we couldn't verify whether or not one was ever done. But it did have some very important fields that we think are beneficial moving forward, on to how do we keep track of this information in at least in one area, as opposed to looking at 3 different areas, okay?
Just a quick question.
Yes?
These 3 databases were being used at the same time.
Yes.
Do we have any understanding about how or why one entry would get into one database versus the other, or was it just random chance?
From what we could tell, it was kind of random chance. There may have been things that were in the hard copy file that were also in database 2, because as I will explain about database 2 in just a minute, but yes, there didn't seem to be a methodology as to when one was used over another. It seemed to be that you used what you wanted at the time. And so we didn't have a clear picture always where everything stood.
Does this mean that people just independently, somebody said database one was created, then somewhere along the line somebody created another database?
I don't know how the database
No.
origination created.
Yeah, so database 1 is HDIS, our internal system. Database 2 is called MySCView. It's an online program that, in essence, you can scan documents to, and allows us to get rid of hard copies easier, so that we're not full of boxes in every single room. But they, as I think Brian's alluded to, you shouldn't have one half updated and one half updated, and the hard copy be a third updated. It turns into like a mess, which I think we found.
So should all 3 databases have been used?
I think that would have to
People are
come.
done, they put information in 1, put information in 2, put information in 3, or?
If that's what GPH wants to do, you can do that. I think it's repetitive, and I think it's unnecessary. I think there needs to be a policy and procedure put in place as to what type of system you're going to use and how to cross-check it.
And there's no policy and procedure for,
At the time, there was not. I mean, the goal would be database 1, which is how we do our receipts and things, needs to be updated. Database 2 would be where you would put the hard copy. Instead of a hard copy file, you just have that. Because obviously the goal is you can access that from anywhere versus a hard copy, you gotta come back to the building, get the file, and then drag it back. And God forbid, as Brian mentioned, you flip-flop something, you drop a paper, it's gone forever. So it's not as easy as like black and white, but it's, there's nuances.
And it wasn't a matter of having the paper in front of you versus doing it remote somehow.
No, we did do paper in front of us for all of the initial audits of the hard copy file. On database 1, we had to be presently here to review database number 1. Database number 2, we could do remotely. And we
No,
did.
not you all, the people doing the,
I don't believe so, not from what I understand, no.
so it wasn't a remote versus
I don't
something
believe
else?
so, no. Because there was, as
Procedure.
I think Mr.
Right.
Kostura mentioned, there's also some things where like, in one file, maybe 123 East Washington, it may have 2 other properties in the same one, and they were just they were scanned in improperly. But the problem is then you miss that in the other file, you think it's not there, it doesn't exist.
Right.
So it was a conundrum, to say the very least.
So let's get back to database number 1, because there's one other, I think, issue that, although it had some benefits because now you have all the information in one area, the one problem that it did have is that there was no way to append documents to it. So you could say that an inspection was done on, July 26th of 2023, but you couldn't append that inspection form to it, so there was no proof. You had to go basically off of what was just, put in that field. All right, now, database number 2, this is an interesting database, and just as Adam discussed, this system doesn't have a field. Basically, it's an address, and then it is a conglomeration, and I use that word loosely, of records, okay? And it is categorized by address, okay? And so what you're looking at is an address, and then what's supposed to be in there is all the records for that specific address. Now, the way this database is set up, unfortunately, it allows for user error. And why I say that is because, and I'm going to use this example, 123 East Washington. If you made it all caps, that was one address. 123 East Washington in lowercase and uppercase, now that's a second address. And 123 East Washington, where you spell out east, now that's a third address. And we could go on like this for several more iterations, and we did. And that's unfortunately why we had 870 records, because many of them were duplicates, transposed addresses, uppercase, lowercase, different combinations, and in each of those files, what you will find is different information for different years. So it's either it wasn't searched properly, or it wasn't categorized properly, or there wasn't a methodology for how the nomenclature was to be used, and so it created these issues. So what are the overall deficiencies? So what we determined when we started comparing all of the different databases is that there was no overarching list of properties that are in this program. So what we were able to do, and we had a great team that spent hours upon hours upon hours comparing hard copy files to the databases, and basically pulling out all of the duplicate addresses, the transposed addresses, and getting all of that information into a more recognizable form. And we were able to determine that there were 566 separate addresses. Okay? And I think that that is the closest number that GPH has to an accurate list, because they didn't have one before. Number two, we need to address nomenclature. Okay? Because how are we going to deal with the duplicate addresses, the repeat addresses, the incorrect addresses, the transposed addresses? I mean, frankly, we found addresses that don't even exist. And we were able to pull information out of there and put them in the right address. And now we have something that, frankly, is usable. There was a lack of applications. There was a lack of proof of payment. There was a lack of signed applications or signed inspections. There was no methodology in exempting a property. So let me explain to you what that means. Exemptions. There are going to be points in time that there are certain properties that may in fact no longer qualify under House Bill 110, okay? Because maybe they hooked up to city sewer, or maybe the business was dozed and it's no longer a business anymore, okay? There was no methodology for removing those properties from the program. So these individuals or these businesses or these properties continue to receive these applications. So we need to have a methodology for when are you in the program and when are you out of the program. And if you are coming out of the program, how are you coming out of the program? This shouldn't be a system in which a random individual gets to make that call. There should be a method for which someone is pulled out of the program. There was a lack of methodology as to when an inspection was conducted, except if maybe the report was in the file. That's the only way we knew, like for certain, that an inspection happened, is if the record was in the file. There were instances in which we found a date in inspection conducted in in database 1, but then we would review all of database 2 and then all of the hard files and never find an inspection report. So we couldn't verify that it was done. And if we can't verify it, then it wasn't done, because there's no way to prove it. So what are our recommendations? Well, one, we need to have a unified list of participating House Bill 110 addresses. We need to have a policy and procedure put in place and hold people accountable to that, with things like dates and clerk's initials that an application for inspection was sent, dates and a timestamp when the application was received, a notation and some type of methodology as to how to prove that the payment was received, whether that's a receipt, whether it's a copy of the check, whether there is some type of proof of payment other than it would have been the fee schedule that we received from the ledger. There's got to be another way to do that, so that you can look at this in one view and say, yes, we have met each one of these steps. we need to have proof of an inspection, when it was completed, who the inspector was. We need a copy of the inspector's report. And then ultimately, what we would recommend is having some type of check sheet that can go either in the database itself, in a hard copy file if that's what you choose, that someone has reviewed it, someone has signed off on it, basically saying that I attest that all of the information in here is done. And then, what someone could do yearly is to go back and say, oh, we're missing an inspection report, where is that? And you can go back to the inspector and find out, or maybe it slipped through the cracks, things like that happen. And that's not a terrible thing, because we're all human. But at the end of the day, we have to make sure that we're doing our job. And so we can have that internal audit. You don't need to have an external audit come in, like us, and do this every year. This can be done internally, so long as you have a methodology for it. I think something that is going to be imperative is, how are you going to store this information? How are you going to categorize it? Where is it going to go? Is it going to be in a database number 2 where it's basically OCR pictures of all the documents? Is it going to be more in line with a database 1 where you're just filling in the blanks? Are you going to revert back to paper files? I don't think that's what you want to do. And then you need to create a policy for when things are exempt. There has to be a policy in place so that anybody who is working the front desk or opening the mail or working at their desk can realize when something comes across, yes, this is an exempt property, no, this is a not exempt property, and how did we get there? So, I'm sorry to tell you, without a complete overhaul of the system, I think these issues are going to continue to present themselves. And so our recommendation is that you start putting in place these things incrementally now. So you need your new policies and procedures, you need to have that unified list, and you need to figure out what type of repository you're going to keep this information in. So with that said, I open it up to questions from the board.
Do we have any idea of the actual real number of small commercial entities that currently in April, May of 2023 qualify for this?
Based on
Do we
our
have any
review,
sense of a number?
based on our review, comparing all 3 of the databases, we're looking at 566. 566 separate entities.
And there may be additional ones that Mr. Lark or a sanitarian or our registered environmental health specialist would have to go out and see should they have been added to the list, and they weren't when
Right.
they became a business.
That's my point. We don't know from some
Correct. That is the best list we have right now. I think what
Right.
Brian is saying, Mr. Kashir is
so
saying.
we don't have a licensing.
Well,
area that
Mr.
we
Lark
can
had
go
a
to.
good idea. I forget what's the name of the initials for the PTI. That maybe we'll get that from someone that we have access to, and that could be the list. We still need to cross-reference. We still need to
Right.
make sure because
Right.
some of them, as Mr. I think Shura alluded to, some of those came back from the public and written on there in black Sharpie was, I connected to sewers 2 years ago. Stop sending me this. But we kept sending it. So it's not a laughing matter, but those are things that Mr. Lark and his team and Mr. Kashir mentioned. My assumption is starting off with this, we in essence scuttle everything that we have right now to some degree. Start fresh with new files, because obviously the paper files are not in order that can be used. There's things in the wrong file. The online system has things in the wrong file, and so we'd likely archive is a better word for it. Those processes, and then start with the new procedures so that we have clean files and we're not spending 2 years going back and trying to reshape all the files.
Right.
We had a brief introduction to this House bill information, the potential that there might be some information that didn't work, and that's why we gave McDonald Hopkins the authority to go do this audit. But in that March meeting, we had been told that 2023, we're current, in 2022, we were current. What system are we using right now?
So right now, we're still using the current systems that are in place because the main goal I had is that when this first came up, and I approached Brian, was I had some concerns, middle of 2022, I wanna say, if Dan, if I'm correct. I asked Dan to do an audit, an internal review of a couple programs. Some of those were already brought to you, like camps, where some of the fees were off, pools, some of the fees were off. We already took those two. The biggest one was this program. And as I mentioned in one meeting, this is where Dan and I worked. We hit over 120 hours in 6 days, trying to get all this done in time to get it to Brian and his team, because his team was coming in. And that is what we did nonstop for the better part of 2 to 3 weeks, was just this and nothing else.
But I think Lynn's asking, like, are you using database
We're
two?
still using all three right now.
Okay.
But do we have assurance that Dan and team are inputting everything correctly right now?
Right now, to the best of our knowledge, yes.
Okay.
The goal would be to have a mini audit from one of our team members go through and just double check a couple of them. That's how when I used to do audits for a living, that's what we do. You'd always spot check somebody else's work. Not 100%. That's where the main goal, where I was getting to this, was the main goal with me with Dan was to get us up to date. Because the mere fact, from an ethical and moral standpoint, and legal for that matter, they were charging for a service that we did not provide, kept me up at night. And that's where Dan and I said, all right, we're gonna tackle this as much as we can in 2022. The goal is to be fully up on 2023, and then start the normal cycle, because there's a cycle to this, in 2025 technically, or 24, sorry, 24.
Mike? Yeah.
Dan, there's 88 counties in the state of Ohio.
Yes.
Am I to believe that all 88 counties have created a different way to accomplish this task?
Well, the
There's no
HGIS
uniform.
database is pretty common throughout the state, a lot of different health departments. It is an old program, an older program, but a lot of counties do use it. Some other counties, I know, like Cuyahoga, they have their own IT department, and they've developed their own software programs and stuff. There's some other different, package programs that people use, but,
Can you give me an idea, if it's okay to do so, what Lake does with this?
we use the HGIS program.
And do you have a separate database that you use to store the hard files, or do you?
Actually, we really don't keep the paper ones. We actually scan, when they come in, we do scan them into the.
So I guess help answer if I can speak,
Yeah.
it was the intent was paper was king. And then we had a part at 14, and we did a lot of discussion at the state level that paper is not good. You lose those records. So paper was just a transition to get that electronic. So the first system, paper, second system was HGIS, which has been in 85% of the health departments throughout the state, kind of homegrown software. That was like all the data. SC View, which database 3 was more about archiving and allowing the full transition from paper to electronic, so that owners could get into it, the auditors could get into it, but it just wasn't executed well. So the tools are about the same, it's just how you utilize them that is the problem.
And the double check is what I'd still go back to. I mean, even audit firms, I used to work for an audit firm, the auditors audit the auditors. There's other auditors that audit a different set. We need that internally, where Dan or someone from his team goes through, maybe a food staff who's outside of that program, and just looks at the checklist. And we've already started rolling out, or at least getting some of that procedure ready. But obviously, this is gonna be a huge time suck for the staff, because we're talking about looking back and recreating a lot of different programs, retraining people on how they can be done, retraining clerks, is it all gonna be in all caps? Do you spell out street, or do you do ST? What if you do ST period? Those are all things you have to think about that could drastically change what the product is.
Yeah, staff turnover or attrition, all those kind of break the cycle.
Right.
In follow-up to my question, are you confident that Lake has a system that has addressed these issues, or is
Yes.
Lake's system deficient too?
No, I'm very confident. This is a yearly program that we run, so that we get the applications in, we review them, we do conduct inspections, we submit the results to the EPA on a yearly basis.
So since we are contracting out our environmental health employees to Lake, wouldn't it be logical for us to switch to a system that is operational, running properly, rather than?
So
Then creating something.
It's a matter of, I think like Ron said, using the tools appropriately.
yeah,
So
same
it's just a
system,
matter of,
but just different execution on
So I
I
think
think we can learn from the safeguards that have been put in Lake County, how to do it properly. Has this process already been mapped out?
Yes, I think we're pretty successful at it.
And for most counties,
Yeah.
it's certainly not a county thing, it's a standard operation in the majority of the counties.
So, do you wanna go ahead?
No, go.
So, do we have a process right now that's gonna solve this problem, working with Lake has been successful at it?
Yeah, it's on the doorstep, we wanted to make sure we knew the scope of the problem. We don't assume that we knew
Right.
everything coming in as new staff or
So,
be trained, so.
Yeah, and we're using the current list of, I think, the 566. We're having the staff, so we have all the paper copies kept in one location now. We really haven't started. We just want to keep them all together in one area right now. And we have one staff member whose job right now is to make sure that we're getting through all these inspections in the timely, in our time frame that we need to get them done. So we can catch up on the inspection portion of who we have listed as, got permits over this last year. So we're all caught up on that, and while we're working on that also, we'll be working on the backside to tighten up the controls on
And
this.
here's what I can tell you, based upon our review of all of the records and all of the different databases, in 2002, when an issue was identified by GPH, there was a marked difference in how the records were inputted into the system and then identified. Because we were able to then identify 97 separate records, proof of payments, and applications, which if you look back a year prior to that, I think that there were 0.
Okay, so the question I have is, we're talking about 2010. How do we know there's nothing in 2009, 8? I mean, how do we know 2010 is the defined period?
We have to rely on a little bit of investigation, okay? And part of that is that there was an internal review conducted by GPH, and that program was running at, I believe, what we believe to actually be an effective manner up until the 2000, roughly 9 time period. And the reason for that is because there was a full staff. In 2009, it's our belief that based upon staffing cuts due to budget cuts, that the staffing was slashed by, I think, roughly 10 folks. And it ultimately resulted in different programs being put on hold, or the implementation of those programs being put on hold.
Or the
And so,
experience,
yeah, so we were able to determine that starting in 2010, we're pretty confident that that is about the time that things kind of came off the rails.
And this was through discussion with staff who were here during the time as well, because obviously, you know, if we can't find a box, doesn't mean it doesn't exist, there's not files somewhere. It was through discussions with staff and who were here, who are here, that we determined that this is likely, you know, we were told like, hey, there's a staffing cut about that time, or attrition at that point, and it kind of matched up to where it was looking at. Dr. Henderson, I would say we cauterized the wound. So as of right now, there's no more bleeding as of the end of 2022. We're rebuilding what was damaged though, is kind of what's going on right now. To Dr. Rude's point, I think yes, we have procedures, we have them, we can put them in place. The main thing was waiting for the audit to be done, to make sure we did put procedures in place that still allowed the blood to flow out. We had to make sure everything was cauterized and that we had a correct way to move forward. And I think now that we have this, we can be relatively confident that we have the procedures and steps in place to ensure this does not happen again. I have reached out to OEPA, who we contract through, because obviously something of this size is an issue. I have reached out to the person who oversees ours, I reached out to that person's boss, and I reached out to one of the regional directors. They're aware of what we have. I told them I will give them a copy of the audit once we have it, so that they're aware of it. They may come in and audit us, I don't know that for a fact. And so,
Who may come in and audit us?
the Ohio EPA, because they're the ones that hold it, we contract through them. So those are all realities right now that we're playing by ear. Obviously, we had to bring this to you first, we had to wait for the audit to be fully completed, because we only have what we have. So I wanted to make sure we were 100% accurate in what I'm telling them, and I'm not to go back a week later and say, hey, by the way, the audit said I was not correct, and this was not what I thought it was. And the other reason, as mentioned, I think, to use Mr. Kashuri's firm was, I've done audits in the past, but the problem is when someone has a potential bias, you don't want them doing the audit. And there'd be an avenue on both sides of why you would say this did or didn't work. An outside perspective is what you need. Plus, I may say, hey, that kind of works, whereas Brian may say, it does not work. We see that if you're objective, it does not work. And I think that's important. The other reality is, I wouldn't have got to anything else for probably 2 or 3 months if I don't his team done at the time they did it.
What
Okay.
led to you questioning this problem and investigating it?
So by no means am I a REHS or a sanitarian, but I like to learn about what other people have done. I had an idea of what was done in Lake for some of these programs, as well as like in Trumbull and some other counties that I learned from. And during that, there was just concern as to what staff was doing it, and I didn't see anyone that was actually going out and doing it. And then I asked Mr. Lark to look into that amongst 2 or 3 other things. And at that point, he, to the best of his knowledge, none of the staff we asked, like, who's doing this, and they all said, none of us.
Okay.
Yeah, so.
So the other end, if we happen to, at the end, or at some point, if we find out there's a small commercial entity that's just not recognized, has been dumping all sorts of waste, will we have some kind of process to investigate whatever they're dumping to see if it's causing a local problem?
Yeah, we still have nuisance complaints and other things, which we've actually had a rash of nuisance complaints lately, honestly, from other government agencies to homeowners. Those were actually not being done timely at all. I mean, there were some that were actually years old that had not been investigated. We actually got to all those nuisance complaints, not all, I'm sorry. We're going through all the nuisance complaints and they're now staying up to date on those. So if you were to call in as an example, say your neighbor is throwing sewage on, we go out and investigate that. We had one about waste on a property, which could be anything from,
But specifically, these small, the HT10,
So,
110 pro.
yeah, so I think the list from the state, we're gonna try to get a comprehensive list.
Yeah.
Dan, about trying to do on 1 and 3 year cycles to try to get the whole list in 18 months or
Yeah.
less to reduce the issues that we have and
Yeah.
to expedite the training and
And-
compliance.
What I will also say is that what you as a board will have to think about, my recommendation is only a recommendation, morally, ethically, and I'm not saying legally, because I'm not a lawyer.
I was gonna say, I was gonna get to this part. So
Yeah.
I think there's 2 parts to this solution to this problem, right? One is, what are we doing going forward? What are the policies and procedures in place so that, to make this right? And then what do we do to make this right going back?
I think-
Because people spent $750,000 for inspections they did not receive.
I think morally and ethically, legally I leave up to the lawyers, but morally and ethically, I think you have to return the money. I don't see a moral high ground, I don't see an ethical high ground. I don't think I could sleep at night if I knew we were just gonna say, hey, it's ours.
Yeah,
In the March meeting, we talked about hypothetically, what would we do if we found what the number was? I don't think anybody expected the number to be like this, so this comes down to, and where do we find the money to pay back
And so,
$750,000?
and so part of my thing was I was actually hoping to have a budget revision tonight for 2023. Obviously with the contract with Lake, we have to change our budget some.
right.
I did not do it, surely out of time to some degree, but also, if I put a budget before you, and then I change that budget by $750,000, and we're a $3 million budget, it looks a little funny that I'm asking you guys to do massive budget changes 2 months in a row. And it would be somewhat neglectful on my side, honestly, if you had to do those individually and not have them track.
Yeah, so I think we need an updated proposed budget for 2023, including that 750 odd. And then, Mr. Historia, do you believe there's any other legal fees associated with this in administrating these checks or anything?
You mean going forward from here?
Yes, to the extent, the board votes to credit these folks or to issue them checks to cover the cost of these inspections, what sort of fees may we be incurring in addition to the actual?
My recommendation is that, we have a list of addresses, we have a list of properties. It seems to me that there are businesses out there that make their living off of doing what we would do in, for example, class actions, where you'd identify a group of people and then contact them as it relates to an issue, and then if in fact a refund of some sort is going to be issued, or a payment of some sort is going to be issued, that they would take care of that for you, once, of course, those funds are transferred into, for example, like an escrow account. And generally speaking, those businesses can do it far more efficiently than, it is putting a full-time staff member on it for months at a time, and can do it much more efficiently because they have the programs and the systems in place to make sure that everyone that's on the list is getting contacted. They have ways to check with people that may have moved, and to follow up with, people that may have paid in the past, but are no longer in that residence, or that business, I should say.
Yeah, so that is something that we have to find out. We don't know who,
And I have
quote unquote,
recommendations.
the owners
Yeah,
were at that time.
I've used a claims administrator, I'm
Okay.
sure, yeah.
Yeah, I have
Mr. Springs as well.
recommendations that I can provide to you, and those are much more reasonable than you would expect. And they can get bulk mailing rates for those types of things, so it can bring down your costs even more.
Yeah. So I think when we rebuild the 2023 budget, we need to include some fat in it for administrating.
Yes, and that'll be our reserve, so those are the reserves we have to carry over from year to year, that's gonna have to be.
Okay, so that's what I was gonna ask, so that's coming out of the reserve fund, so we're gonna have to talk about how that impacts the reserve fund. And then I think another thing to be discussed would be how this is gonna impact operations going forward, because there's been nobody doing this.
Correct, right now we've assigned somebody full-time to do it, but obviously that person is taken off of another task to do this
Right.
task.
Right.
So that is another person that money's been going somewhere else, and now we have to staff a person to do that task. So Mr. Lark and I have been working on that consistently, to figure out what that plan will look like for staffing, and we can definitely push that out. Once our new staff actually just started Monday, Valerie. So we're getting caught up with some things. We're hoping to not have something like this, we got even more caught up, but, this'll just impact that.
What-
And we'll
what
bring
is-
in the revenue to help support that position though.
What is the ballpark in the reserve right now?
At the end of 2022, I want to say it was 4 million, give or take, and that was with some offsetting of like expenses still to go out, things of that nature. But you're talking roughly a third or a fourth of it is likely what's going to be used. I mean, given
Yeah.
with some of the changes we made with some of the revenue side of things, it'll only be a third or fourth of it probably is going to be used towards this, which it took years to build that up. I mean, years. We're hitting it pretty hard in 6 months.
And just for, the reserve fund is there for what purposes? Just so that we all understand.
For the use of the entity that is not, what I would say is it's uses that are not typical. So it's not something you plan for in general. It could be a bad year where revenue takes a hit, that offsets that, so you're not doing anything that you don't have to. That is also for things like this, an unexpected expense of significant nature that, they're.
Emergencies?
Right, $5,000 and $6,000 expenses, we can eat those. $100,000 expenses I cannot eat, and $750,000, I don't budget anything near that in the budget,
Yeah.
not even close.
Yeah, that's a lot of.
So, not to cut this short, but if we're okay moving on, I do wanna make sure we get the DDC staff to talk,
Yep.
since they've already been here an hour and just loving our conversation. But I don't wanna keep them for 2 or 3 hours.
Understood.
So if you wanna take time to review that, we can decide what we wanna do in the future, next meeting.
I would like to have time to think about this and come back to the next
Yeah,
meeting.
I was gonna say, the only thing I wanted to discuss further is if we should have a special meeting to purely discuss what we wanna do going forward with these audit findings.
I think that's probably prudent.
And it would allow me to get the budget done faster, hopefully. If we gave it like 2 weeks, I could get the budget in place, have this stuff in place. I also talked to Mr. Walter about how to handle some of these funds, because this is not a typical expense we have, obviously.
Do we wanna float a date right now?
I will be out of town from the 6th through the 13th of May.
Okay, I can't do the 10th either, but I could.
I'm out of town May 2nd to May, I think it's 13th.
All right, what about the 17th? May 17th,
What day of the week is that?
Wednesday.
I'm out
Can you
to
do it
that.
by then?
Yeah, I could have some stuff together by then.
I,
What if we go with that as proposed right now, and if anybody has any changes, we could always modify it for the meeting today?
Yeah. That works
That
for
way,
me.
that way you
Yeah.
still have some time to think about it.
I have out of town guests.
Okay, so we'll think about it a little more as we go. I just don't wanna keep the DDC staff
Okay,
a ton
understood.
longer, and I apologize for that. Any other questions for Mr. Stewart, can he get out of the hot seat for 2 minutes?
Absolutely.
Thank you
All
very
right,
much.
Thank you.
Thank
Um,
you.
I'd like to invite the 2 DDC staff up, if you'd like to both come up. Put you in the hot seat now, in a good way, right, in a good way.
didn't warn us.
Yeah.
It's all part of this direction.
If you'd like to take a seat, you can, it's just, it happens to be here, we don't usually use this
Yeah,
for
I
2.
feel like
Um,
commissioners.
I'll let you both introduce yourselves, that way I don't butcher any last names or anything. So go ahead.
I'm Valerie Sensi, I'm one of the nurses at the DDC clinic.
And I'm Patty Gallagher, I'm the Operations Director at DDC Clinic.
So in my section, you probably saw some information about the DDC. They were both willing to come out here. I want to give them a chance to talk and for us to work with them. So 2 things. There is one of the documents that's in front of you. It has DDC Clinic Center for Special Needs Children. It's on this document. That is a letter of support they wrote to us. What I'm proposing we do, which does not require a board vote, but I want to ensure that we're all on the same page. Our vaccination clinics here at the health department, we do the best we can, but they are somewhat limited in terms of the Amish coming all the way to here. We had one actually just last week where we had a mother of 10 that canceled, and that was most of the clinic, right? And then that spot is no longer taken by anyone, because they're not coming in here just regularly for those things. I talked with the DDC staff and Dr. Wong, who's down there amongst some other people, and my thought is if we provide one of our nurses, who's actually Melissa in the back, Melissa can smile and wave, Melissa, and then also a part-time PRN nurse for about that one day, we would provide a nurse and a half or even possibly 2 nurses on every Wednesday. After our clinics, we still have our clinics in place up until about the end of June, I want to say, Melissa? Every first and third Wednesdays. After those are done, and possibly starting sooner, we'll do the 2nd and 4th Wednesday with DDC. And then once ours are completed, we'll then move to every Wednesday with the DDC. We will provide the nurses where they can provide they'll have vaccine on hand. We provide the nurses to give the vaccine and help out with them. The Amish are already going there for multiple other reasons. They can augment their services significantly with the additional staff. I think it gives us a better bang for the buck in terms of this, who usually comes to us anyways, which is like 95% Amish, are already going there. If someone does cancel, they can then use them for other things. So we can still keep that ball rolling, still keep helping the Amish, and still keep prioritizing that area of the public. The DDC offers a multitude of other services as well, which I think we can help augment on that aspect as well and help them every single Wednesday. Melissa and I talked about providing a clinic here for Yankees, as they're commonly referred to, or additional staff on a different day if we need to, for those 5 or 6% that were non-Amish. But I think this may be a better use of our dollars and staff to work with the DDC, who's already honestly just thriving on this. And Dr. Wong mentioned they have some stats where other counties that have a fair number of Amish have seen rates go down and are seeing our rates go up when the DDC came into existence. So they are providing an impact. They have the numbers to back that. And I think this is something that we can do to really help the community in that area that we're looking at. Pertussis being a big one that they've seen as well as we have seen. And then obviously with the Amish specifically already going there, it's a far longer drive up to here, as well as you have to pay the taxi to get up here and back. If they're already going there, you're already getting that captive audience that may say, hey, you know, I was interested in that, but I don't want to drive all the way up or get a taxi all the way up into Chardon in that area. So if the board would be so inclined, that is the direction I'd like to head. They do have a part-time nurse right now that already knows how it works. My thought is we offset that expense for them on Wednesdays. They can then use that money for an additional nurse or what they need to help out. But we would provide a nurse, in essence, 2 nurses every single Wednesday, give or take, probably starting in July. We'll do the 2nd and 4th Wednesday as soon as we can. Obviously, we have to work out some things, make sure everything T's are dotted, or T's are crossed and I's are dotted. But I think that would be a solid use of our time. I've also reached out to State Rep Steve Demetrio. He has put a budget line item in for the DDC into the state budget. He's also willing to help us look for additional revenue for the DDC. They're a nonprofit, we're a government entity, which allows us to attack 2 different points of grant dollars. And then I also met with the Ohio Department of Health. I was actually in Columbus yesterday or Monday and Tuesday. I met with the State Department of Health. They're willing to also assist us with trying to find revenue for the DDC. And I didn't get a chance to talk to Patty or Valerie yet. But on the 18th of May, I have a special needs fishing event that I'm helping Commissioner Dvorak with. They're willing to come down for the special needs fishing event, but also they'd like to see the DDC clinic and talk with them about how to give them additional funding. So I think between our 2 groups, we can do a lot of really good things for the community and really capitalize on the investments that we're making in that area. And they run a first-rate shop. I mean, I went down there. They amused me by speaking with me and letting me, ask some questions and whatnot. And they were absolutely fantastic. And again, they're very well respected. They're very well respected at multiple levels. And Dr. Wong is a world-renowned geneticist. So it's a gem in Geauga. It's right there in Middlefield. So I want any questions you may have for them to be answered, because I probably butcher everything that you do.
No, you've been good.
But I can't even say that.
Adam, you had me at hello.
Hello.
Because I've been a practicing physician in the county for 35 years, and I'm well aware of the great work that DDC does. And you've hosted Leadership Yada on multiple occasions, and a number of the leaders in the county have had a chance to go through your facility and see what good work you do. I think it's a huge step forward. It sort of harkens back to a point I made several months ago that I thought we needed to improve and enhance the record keeping and the ability to provide the vaccinations for the Amish population than what we had at that point. This goes well on the way to improving the service rather than just trying to have it loop along. So I'm thrilled.
And I would like to thank you on behalf of the agency, the health commissioner here. We've contacted by the state for pertussis. There's 5 cases. About 2 weeks ago, there's 13 to 14 cases, many of which aren't diagnosed, and disease doesn't know boundaries. So for us to be able to intervene and have a partner trusted in the area with access, it makes all this stuff to replicate what they do. So thank you.
Thank you.
Any other questions for the?
No, sounds like, no problem.
Anything you would like to share? Maybe other things you do or other things you'd like to see expanded upon that maybe we can help on?
No, it goes back to what Adam said about how they come to our clinic, because we are actually booked out through September. They just can't get in quick enough, and they'll even call the night before, the day of, to see if there's any cancellations, so they can get in. So there's no lack of patients coming in.
And these are people that are not our patients, because our patients that we see on a daily basis or however can come in at any time and schedule an appointment, because they're already our patients, we take care of them, so that's not an issue. So these people that are booked out till September are people that are not our patients, that are just coming in because we're in the community. So, it's a service that we provide, and we've done it for 15 years now, and very successfully.
So, barring any frustrations with that, I mean, I'd like to move forward on that as quickly as possible. I've talked to Melissa about it. She is game to be part of this. I think it's a new beginning, to say the least, on providing some of those services and partnering with a community asset that is there. I mean, they like to help. We have the ability to help them with that.
Seems like it'd be more efficient for everyone as well.
I think in general it will be, yes. I mean, that was, I mean, you all know, that's my opinion on most things. Make it as efficient as you can. If the wheel already exists, don't create another one. I think the wheel exists, can we augment the wheel? And that's what I think we're gonna do. So, ladies, thank you for coming in.
Thank you.
I
Thank
just
you
want to
all.
thank Melissa as well, part of the team. She stayed on through all these discussions, and from a staff standpoint, that is very, very stressful. And
Yeah.
so I'm so glad to have Melissa still on staff here and working through that.
Thank you.
Looking forward to working with her.
Yes.
Thank
Thank you
you.
all.
Thank you.
Thank you.
Apologize for jumping around like that. I just thought that was a good, I didn't want to keep them here until, I mean, I'm sure you'd love to stay with us until 8 or 9 o'clock.
Other than I do our own board meetings, so I don't really need to. Thank you.
And Patty, if you can look at your calendar, see if May 18th works.
Yeah.
That ODH will come down and we'll meet with everybody.
Yeah, I'll catch up with you then.
Thank you.
Thanks.
That same vein, just because you already had that paper, the special needs fishing event is also on there. If anyone would like to attend, you can. That's something Mr. Dvorak has done for some time now. He's looking to kind of have some help and hand it off to some degree, so I'm already part of the Chardon Rotary. We'll help with that and help lead some of those things. And I also had some extremely good news from ODH along these lines that there's a grant that will actually allow us to buy equipment for people who don't have it, which would actually include fishing rods. So we'd be able to actually buy these children their own fishing rod they could use besides the ones they may borrow, which would be a huge way to, again, keep them out there. I went there last year, Mr. Dvorak. There was nothing but smiles from ear to ear the entire day. The police are out there, the fire station is out there. They're fishing. It's a partner with the ESC, the Education Service Center. They help bring them out. It is one of those hidden gems of this community that most people don't realize that some of the stuff that happens, that it's huge. So I think this is a good way that we can help out as a health department and continue this program, into much later down the road.
I'll be there if available. I know internally, the partners at Geauga introduced myself as well, so if I'm there, I'll be happy to greet you guys as well.
All right, great.
So we can get back to our regularly scheduled program now.
Sounds good. Population health update.
Yep, everyone has the report in there. If there's any questions, we'll be happy to answer them. There's definitely a lot of information there, for anything child fatality review to the FEP grant, to get vaccinated Ohio. The GBO grant, for those who don't remember, that is the one that the state no longer allows us to have due to our size. Lake is housing that and providing it still through us, so we can still keep the staff working on that program specifically.
And when you say by our size, it's being based on our population.
Yes, population, yes, sorry.
Where is the population report?
That was included in the long document, the one that was emailed out,
Okay, flipping over.
yeah.
Oh, sorry.
Sorry, go ahead, any questions on that one?
That's
Sorry.
all I was gonna say too.
Sorry, jump the gun.
Any questions? No? Okay. Moving on to the environmental health.
Hand that off to Dan.
I just wanted to add two things besides the report. One is we did have a new registered environmental health specialist. I don't want to say sanitarian, but that's not the legal term anymore. On Monday, Valerie McCaffrey. So we're happy to have her. She jumped right in and working with us already. And then just the other thing, on April 15th, we became the representative for Small Flows, which is working with small commercial septic systems for people who want to do that. Not quite as big as the 110 stuff, but smaller in between residential and that. So.
Gives us more control locally, which is a positive thing. Allows us to make some more rules on our side or more.
Yeah, and we can process stuff a little faster for business
Faster,
owners.
cheaper, tailor it to specifics of the community.
Perfect.
That's good.
All right, health commission, oh no, administrators report.
I'm just going over because usually the goal is that it's up on the TV, but the TVs aren't working today, so a little frustration there. But Parkman Wells, we did complete the first operation of that grant. So the first grant that we had, we did complete that. We're now billing that. We received the bill. We're paying that out. The last part we have of it is actually fixing the landscaping, which we got approval from OEPA. So we're fixing that up. That we had to wait until obviously the weather was warmer. It wasn't icy, sludgy, something like that. So we're finishing that up. We did get news actually just recently that they're actually going to move the Parkman ODOT salt dome, and they're going to clean it up. That was huge. State Rep Steve Demetrio, I think, played a huge role in that, as did Mike Deerfield and Henry Sheriff from Parkman. But they did announce they're going to move that. They're going to clean up the site and move it. I made the joke that just like they do with schools, you can always sell that property once cleaned up to the township for $1. Not just going to happen, but I'm sure they could do something useful there for the community.
And along those lines, are they really sending it to Michigan?
I do not know where they're sending it at.
That's supposed to be a joke.
Oh, okay. That one I don't know.
We haven't got much news lately.
Who's on second right now? And the DDC clinic, I don't want to belabor that one too much more, but that one we just talked about. The Geauga Amish population, again, I attended the Columbus meeting Monday and Tuesday, had a lot of really good things for that. We also met with the university hospitals. A while back, I floated the idea that we should start a grant just for their eyesight clinics. That was successful. It ended during COVID at some point. The new COO and the new head of UH, we mentioned, I said, my understanding is it all goes to corporate. They keep saying no. And he goes, no, because we can do that. It's like a $10,000 contract. It's not a lot of money. he's willing to do that. To us, it's a lot of money, but I'm sure to them, it's different with UH. They're willing to help fund that again, so we'll start going back out to the Amish schools and providing eyesight clinics, which was hugely beneficial for them. There's also some grants I was made aware of that can help them with not only glasses, but also maybe help with the cost of doing the clinics for them, so we're looking into that. We meet with the Amish superintendent tomorrow night, actually, here in this building. We're gonna meet with him and go over some ideas and things that we can help them with via inspections, how to help the schools, the eyesight clinic, a little bit of everything.
Pardon my ignorance, but
Yeah.
what is an Amish superintendent?
He is the head of all the Amish schools.
Okay,
So kind of like the Yankee
Superintendent of
version is the
schools.
ESC, he's the head of their schools.
yes.
As you may know, there's some animosity with us and the Amish from a little while ago. Mr. Tiber, who left, actually helped facilitate that. And I think there was a little hesitancy at first. Mr. Tiber said that we have nothing but goodwill we're trying to push towards them. And they were eager to meet after that. So this is it's a huge step. It's a huge step.
Great.
The operation and maintenance program, Mr. Lark and his team are leading that. The goal is still to launch it in 2023 with the focus on the NPDS systems. The ADP team is going to perform a technology audit for us. I've requested that, so they're going to go through all the computers we have right now, do a full audit of those and all the IT equipment, and then give us a recommendation what we should replace it with, because obviously we're hitting our lifespan of our laptops. And some of the laptops honestly are heavy enough that no one would take them home because they're honestly, they're beasts. So we're gonna have them look at that. I'll get a quote and then bring it to you all for a vote to update our technology equipment.
One thing I was gonna ask about that is, the water resources, IT breach,
Yes.
are we better insulated from those
Yes.
sort of cyber attacks?
Yeah, we moved everything that we could to the ADP system, and that is because it sheds liability for me and puts it on them. So they do our gatekeeper systems, they do our laptop rollouts, or they help us with that, I should say. The only thing we really have is our phones. They don't do phones, so we do that. We are looking into what we should do to better insulate our phones, though. So we are looking at that. And then audits, our state audit for 2021 and 2022 did start. I obviously have to disclose our House Bill 110 issue. That is likely going to increase the cost of our state audit, and it's going to increase the scope of that audit. For the mere fact that it did hit on a financial side. They don't audit the control side necessarily in certain things, but once you say you have an issue of this size, if I was an auditor, I'd be like, man, we're coming in hot and heavy on this one.
So we have to pay for the audit that the state does?
Yes. Yeah, and it is not cheap.
What's not cheap?
The audit.
No.
I'm
Or
gonna,
like, what does that mean? What's the
I'm
number?
gonna guess this year we're probably gonna look at $15,000 or more. I would not be shocked.
No, that's not what I thought you were saying.
No, it's
How
not,
much
it's
bigger
not
it is.
monstrosity, but it's not a cheap audit either. And then, that's it from my perspective, other than, the May 19th is when we're gonna have a press day for Parkman Wells. So we're gonna be down in Parkman, a couple state reps are gonna come down, I believe OEPA is gonna come down, possibly governor's office, and we're gonna have a discussion about how it happened, the changes that happened, things of that nature. As most of you know, I had that day off. That's one of the few days I had off. I will be here. I'm just gonna leave that night to go where I need to go, because that is the date that works for everybody. So we're gonna be here and handle that on May 19th.
Thank you.
Yep, no problem.
I have a question. We're now 3.5, almost 4 weeks into the transition in personnel.
Yes.
Can you tell me how it's going?
It is going very well in my opinion. The staff that came over are doing a fantastic job. They've had a very positive attitude. They've said it's a lot of positivity right now. Having a paid lunch didn't hurt before it wasn't paid. So having a paid lunch did not hurt at all. But in general, very positive, upbeat staff. They've got, we have some really talented staff, obviously, like Melissa, who's out talking to the DC ladies, who are totally invested in helping the community. So very, very good in general. The sanitarians have been nothing but phenomenal. Dan Lark and his team have been doing a great job. We've been hitting nuisance complaints at a reasonable rate, whereas before a lot of them, Dan, what was that? It was what, 5+ years with nuisance complaints, I wanna say, or was it less than that?
Which one?
The nuisance complaints that were outstanding?
Oh, yeah,
It was like 5 some years. And obviously, from my standpoint, if Carolyn calls in and says, hey, my neighbor had sewage on my property,
Yeah.
and 5 years later, you're just getting to it,
That's a
there's a problem.
Our goal will be 3 days, 3 business days to get out to those
Yeah.
type of.
And just to
places.
follow up, can you give me an idea how many open positions we have?
The one EH clerk was hired, we pushed a start date back. The FEP coordinator, I believe, was offered the position, and the EPI was offered the position, which leaves us with, I believe there's no open positions, or no, there's one sanitarian,
One sanitarian,
sorry.
one clerk, and
And we've interviewed
We've
for
gone
that.
through the initial interview process, but we haven't made the hire decision yet. I'm thinking it's done between the interviews, but we have probably one position that's open right now. We actually had probably one of the best candidate pools for registered
Yeah.
environmental health specialist sanitarians in a long time.
Similar
Good jobs.
preparedness
Good,
and
yeah,
it's picking back up.
epidemiological.
really good candidates, which.
Alright, so
is
we,
awesome.
so we have 3 offers out and 1 open position.
Yes, and I think all the offers we accept, I don't see anything, I don't see anyone declining the offer, but nonetheless, they are out there, I don't wanna, jinx the horse or something.
But thank you for your leadership on that, and you as well.
Yes.
Thank you.
The finances are next, they're like attached to my thing, that's why I just mentioned that, it kinda goes to the bottom of my administrator 4.3, or 4.0302, goes into the finances next, just as an FYI. Also, I almost forgot, I told myself I wouldn't, I believe we will have very soon a contract coming to the Board of Health for an additional $600,000 from Ohio EPA for more well replacement in Parkland.
Oh, great.
Due to the House Bill 110 and some other things, that was my focus right now. But Dan and I did receive some good words from them, and I believe we'll have that very soon, that we'll have an additional $600,000 for that program.
That's great. So what will that go to? More wells?
More wells,
landscaping?
the landscaping costs, which are minimal at best, because most of it is not too big, but it'd be the wells and the associated cost of those wells, that are allowed by the grant, contract.
Does that mean that we have a lot more at-risk wells than we thought we did?
It wasn't necessarily more than we thought we did, but we knew we had 6 to 8 kind of off the bat with some initial testing and initial conversations. Dan Lark sent his team out, actually house to house more or less, putting pamphlets on doors saying, we want to come out and test your well. And then we were up to, I want to say 16 or 17 was the last one.
And there's 6 or 8 this next round, and then there's still one more street we have to get to.
Yeah,
So 600,000 would cover about how many properties being?
it's give or take 30 to 40,000 a well, depending on any
Okay.
complications, the 200 foot versus not 200 foot, or almost 300 foot, I should say, not 200, almost 300. It just depends on some of those things. Also, we had, as an example, one person had a well that wasn't capped, that we didn't know about until they went to cap another well, they found an uncapped well. And so we dealt with that as well, yeah, as well. Right, not intended. Yeah, so there's a lot going on. I mean, I don't say that for a pat on the back. I just mean from nursing, from DDC to Dan Lark with O&M and everything else, from Ron helping out with everything. It's a lot. It's a lot.
Whirlwind.
Yeah, so we're cleaning up a lot of things.
Yeah.
We're changing a lot of things, and I think partnerships like this are going to take some of the things off our plate, while at the same time actually giving the community a better product.
Yeah, absolutely.
So.
All right, is there a health commissioner's report?
Very briefly, one, as I said, on the grant committee for the state, Ohio Department of Health, there's about 20 of us. I can now advocate for your input and your requests on that for flexible dollars, basically what we want, more local monies, more state money that's local or federal. I can carry forth. I did an interview with National Association of County Officials in regards to the kind of the shortfalling of mental health parity, mental health needs, and the increase over since post-COVID. As far as grants, we're submitting the workforce grant, the Get Vaccinated Ohio grant, and the preparedness grant. There's a radiological response plan that needs to be signed. I signed that. We'll be giving you a copy of it. Just quick updates. Staffing really. Again, we have United Healthcare, UHSS, University Hospitals. Thank you. We're meeting with their benefits rep and looking at how we can serve both counties efficiently, and starting an Access to Care subcommittee underneath our community health improvement plans for both counties. And again, the staff hiring is doing very, very well. Best candidate pool we've had collectively in the area for probably 2 years. So I think partnership is paying off already.
Great.
Thank you.
All right, we have no committee reports, because we have no committees.
We do need to go through the finding, or.
Oh,
sorry.
well, that was on the next
Sorry,
page.
yeah, I apologize.
You want
We
me to-
didn't know, we didn't change that, I apologize.
Okay.
It's more in the order now.
old business, permission to adopt change to home sewage treatment rules. Is that Mr. Lark?
Yeah, so, I provided a sheet last time if you guys wanted to go over how to adoption of regulations. We talked about, the 3 readings.
Oh, yes.
So I don't know if we wanna push that, we can push that back a month if people didn't get a chance to review that.
Do we have that in our
'Cause I
packet
don't think
now?
we'll be,
I think it went out in the
I don't think we'll be ready in the 3-month timeframe, so I think we'll be okay to push it back a month.
Okay,
Oh,
let's-
here it is, it's on page 1, sub 1, permission to adopt.
I'd like to take care of that today if we could, to keep us on track.
Where can I find this? Oh, this is under old business?
Yeah, so the goal is just to make sure we had a solid process for the regulation just.
So you need me to read this out loud, is that the procedure?
Well, we have to do 3 readings and it would just be to change that rule to the, current language that we amended last board meeting. Which
Okay.
was, I think I forgot to add the type system in there if I remember.
We didn't
right.
say NPDS last time.
Yes, yeah.
Okay, so I just read this, is
Yeah, I
that all we
mean,
do?
it'd be ideal if everybody's on the same page.
Okay. Permission is hereby requested from the Board of Health to approve the regulation change to section 3701-29-19E, the Ohio Home Sewage Treatment System Rules, Geauga County Supplemental Rules, to state that the Geauga County Board of Health adopts a rule requiring the collection of the required NPDES samples to be completed by the Geauga County Board of Health. This item was tabled at the March 22, 2023 meeting until a regulation adoption process has been added to the bylaws. Dan Lark said this is needed to change the supplemental rule that Geauga County had previously set to allow service providers to take National Pollutant Discharge Elimination System samples. Currently, that is not being done. Only 8% of the approximately 1,600 systems were sampled last year, and less than 25% of them met the criteria of water quality standards. If the systems do not work properly, they can allow direct discharge of sewage into the county waterways. By changing this regulation section, we would like to collect those samples ourselves cost efficiently and to make sure homeowners are in compliance with the law. Okay, that's all we need to do for that?
I think you just probably make a motion to change the regulation as your first reading.
So we need a motion to,
Yeah, I think you would need to.
Just accept the first reading.
okay,
Yeah,
so,
yes.
do I have a motion to accept the first reading of the permission to adopt change to home sewage treatment rules?
So,
A second?
All in favor?
Yeah.
Aye.
Opposed? Abstentions?
And you do have the ability, someone had mentioned to me, you do have the ability to waive the second, third reading if the board so chose, but I'm not, you don't need to, I'm just saying that was an option as well.
is this a matter of public health that we are not able to
So
do this at this
honestly, we
time?
won't be ready to begin these samples if we go the full 3 readings. We will be ready probably close to that point.
Okay.
So I don't think it's anything we need to hurry to waive the next 2 readings.
Okay, so let's just do that.
Yep, we're good.
Okay, April 2023 financial reports.
So that was actually starting on 4.0302 in the packet. It was after my report. Goes through some of the, the typical things that we usually go over where there's oddities amongst things. The biggest one being the payment to Ferris Excavating, which is for the Water Pollution Control Loan Fund for some work he did. And that was for the, one of the accounts payable, and the revenue expense are obviously listed in there as well. So there's not too much, it's only in April, it's only through March technically, so there's just not that much there.
I sort of missed the report we used to get with all those line items. We just got, we didn't get like the, I don't know if you guys noticed that. or-
No, it should be
Is
in
it
there.
See, I didn't get things too, and it may be in.
That's,
I apologize, it should have been in there.
70102 or 70101?
No, it should have been 70101.
Yeah. While we're looking, can I run, take this break?
Certainly.
Is that okay?
Well, you have to ask permission from the chair.
Hall pass.
Yeah, absolutely, go ahead.
All right.
See, I'm trying to find where I actually have received this packet that we're looking at, and I think I was left off the list.
Yeah, I just saw, we have this.
Yeah, usually you get it's the
But we didn't
expenses.
You don't have this? I mean, these other two pages?
The expenses should be in there too.
Well, I mean, I have this and this, but we didn't have like the line item where it says like blanket whatever and,
Yeah, no, that should have been in there.
and it has like the individual vendors.
It should have came from Gina Parker,
I don't think it was part of the packet.
which then maybe it's,
Usually
maybe
you
the
see
scan
them
issue
separate.
that I didn't catch. I will send you all a copy of that because I'm looking for it right now.
Should we then table approval of these, or can we, or is that gonna slow you down?
It's gonna slow down the bills.
Okay.
I can,
I'm sorry, I stand corrected, I did receive it.
Okay.
It was just buried.
no, you're fine.
Yeah, got no email anymore.
Yeah, it might just not have got, the scanner might not have scanned it, is what I'm worried about. I'll send you all a copy of it.
I just thought it was part of the new packet.
No, it should have
Over
been in
other
there.
business, if we could grab that or no?
No, I'd have to go in the new world and print everything out. It's gonna take a while. It's not letting me open anything right now at all. Trying to open it right now, it's not. letting me.
Should we move this to, perhaps after executive session?
Yeah, let me see if I
And
can
then
get what I need.
That would give us, a chance for you to print and us to review.
Yeah, cause this is not opening anything at all.
Okay. So let's move that, 7.01.01, the April 2023 financial reports. Let's move that item until, after executive session. Alright. So that will bring us to 7.01.02, resolution 2023.4, then and now purchase order.
So I'm gonna hand out these two right here, these are the then and nows. One of them is for the payment to, the previous legal firm that we had used. Those expenses had dates on them that were the prior year, that PO was not kept open. So then and now is the best way for us to get these paid immediately, because they are outstanding now for a significant amount of time. From the date that the work was done, but not when we received the invoice.
What are they for?
For
One is
Flannery Gargalis.
Yeah,
Oh.
one is for legal expenses.
Okay.
The other one is, for those that don't remember, there was a gentleman that came in, two gentlemen actually. They bought a septic system that is technically approved by the state, but doesn't actually meet the correct, it almost never meets the actual thresholds to be approved. We agreed to refund him, part of the permit fee, or say the permit fee, because of how that fluctuated out, and it was that specific system for those specific households. He was one of the ones that did take us up on that offer. It was not processed. So I talked to him yesterday, talked to Mr. Lark, so this is the way to pay him as quickly as possible. It's $925 ballpark.
And the Flannery Gargalis resolution, so what did this include? Was this for drafting of the cooperative agreement,
Those
among
are just-
other things?
Yeah, there was legal
Okay.
services that were provided up until that date. The invoices, I believe I have, obviously they're redacted, I can't just give them out as a public record.
No, I
Those are all
understand.
redacted.
Okay, so I will now entertain a motion to adopt resolution 2023-4 to authorize the payment of a then and now purchase order to Flannery Gargalis and LLC not to exceed $57,928.90.
So moved.
Second.
And this, do we need a roll call for this?
Yes, do a roll.
Okay, any discussion? And, roll call vote?
Dr. Henderson? Yes or no?
Yes.
All right, sorry, I'm gonna do it to help out Carolyn here. Dr. Rude?
Yes.
Mrs. Roman?
Yes.
And Ms. Brady?
Yes. All right, motion carries. I'll now entertain a motion, I'm trying to see what it should say. I guess to adopt resolution 2023-5 to authorize a payment of a now and then purchase order to Adam and Kelly Andre in the amount of $925.
So moved.
Second?
A second.
Who had the second? Okay, and roll call vote for that as
Yeah.
well.
Dr. Henderson,
Yes.
Dr. Root,
Yes.
Ms. Roman,
Yes.
Ms. Brackey.
Yes. Motion carries. Permission to approve, is that, wait a minute, what's the appropriation for the increase?
Yeah, so that's the
I
one we're
saw
not
that.
gonna do.
Okay.
Given the issue with House Bill 110, I did not think it was appropriate to bring a budget in front of you to then have to change it in 30 days.
So that, I think I skipped, Adam, that permission to approve the appropriation.
did,
Okay, so
yeah,
do
you
we
did.
need to go back to that, or?
No.
That's all we're not
We're
doing,
just not doing that one.
or
So,
the 2024 budget?
We do need to do the 2024 budget.
Okay,
So
okay, sorry.
what I believe happened with the 2024 budget is that when we all met before the HDAC meeting, we talked about the 2024 budget. We then got into discussions about the contracting with Lake. We then got into public session. We never came back to voting on the 2024 budget. Everyone had the budget. It was pushed to the HDAC. We all discussed at the HDAC. I cannot find where it's actually voted on and approved. So I do need to vote on and approve the budget for 2024. Please understand, as I mentioned the first time we talked about this, that is a pie in the sky estimate, because obviously that does not include Lake's contract. We have to redo that in December of this year heavily, so it'll look nothing like it looks right now. But we did have to push something out to the Budget Commission, which that is what they looked at and that is what they approved.
I thought the number though, when we showed it to HDAC, was a 500,000.
No, it's negative 468, I believe.
Negative 468?
Yeah, because I did make some adjustments that I mentioned to all of you. That was I believe it's the for sale property, and then some of the offsetting expenses based on having some operation and maintenance in there. So it was 468, give or take.
Okay, so I'll now entertain a motion to approve the 2024 budget.
So moved.
Second.
Roll call for that,
No, it should be nice.
Adam? Okay, all in favor?
Aye.
All opposed? Any abstentions? Motion carries. The budget is approved. Okay, resolution of appreciation for Richard Carino.
Yes. So I have two copies here. Ms. Brackey and I will sign these. These are just, one will go to Rich. Do you want me to read it, or would you like to?
Yeah, go ahead.
Okay.
I read it
Say
on
you-
today.
You've read a lot of different motions. So resolution of farewell and appreciation for Richard Perino for dedicated service to the residents of Geauga Public Health. Whereas Richard Perino was appointed by the Health District Advisory Council as one of the representatives of the Board of Health in 2018, and whereas during Richard Perino's time on the Board of Health, Richard Perino worked diligently to serve the residents of Geauga County and took pride in protecting both the health and well-being of the residents of Geauga County. And whereas Richard Perino served as president of the Board of Health, earning the respect and trust of fellow board members. And whereas Richard Perino's sage guidance was especially helpful and instrumental in transitioning to the new county office building, ending the for sale property program, implementation of the operation and maintenance program, transition of multiple health commissioners, and many other issues, large and small, throughout the years. Now therefore be resolved, the members of the Board of Health, the Health District staff, and members of the community wish to say thank you to Richard Perino for his dedicated service to the board and your fellow Geauga County residents, presented this 26th day of April 2023.
So do we need a resolution, or a motion to approve?
Yes.
Okay, so I'll entertain a resolution to approve, or a motion to approve the resolution of appreciation for Richard Perino.
So moved.
Second.
All in favor?
Aye.
Aye.
All opposed? And any abstentions? Motion carries. Permission to appoint Becky Kelly as registrar. Do you want to make any comments on that, Adam?
Yeah, so, the registrar resigned, effective, the day actually that the person, I want to say it was end of March. And, with her resignation, that position became available. I think it actually means April 14th was her actual last day. But anyways, Miss Kelly has been working in that area for a number of years. I discussed with her the possibility of her moving into the registrar role. She's deputy registrar. She was very interested in that position. She does that job now, and so she'd like to be put in that position, and I would highly recommend that be the position of the board. This one, because it's a registrar position, it requires board action. Most things I can do on my own and say, hey, this person can do it here. This is an exception to that.
Okay, I was wondering.
All right, so I'll entertain a motion to appoint Becky Kelly as registrar.
I move to appoint Becky Kelly as registrar.
All right, second?
Second.
All right. And then I'd say yeas and nays.
All right, all in favor?
Aye.
Aye. All opposed? Any abstentions? Motion carries.
All right.
Well, now, we're gonna move the executive session to after, public comment. So we will now enter a period of public comment. The session will last, 20 minutes unless the board moves to extend, 2 minutes per speaker to make comments and ask questions. The board will answer questions after, I guess we can, answer questions after having an opportunity to investigate responses following the meeting. This is not a press conference where answers should be expected on the spot. Board responses will be recorded and publicly filed with meeting minutes. If anyone likes to go first.
Is there any public comment? Mr. Olishev?
Sure, I'll go.
When you're ready,
to
sir.
read the resolution for Rich at the next two meetings too then?
No. Thankfully.
What's in that? What's done?
Yeah, you guys are in a tough spot as usual. I think it's worthy to have the record state that, you know, nobody here was around when this issue started in 2010 or whenever it started, and it was the action of this board and Adam and Dan and, you know, Lake Health coming in to the extent that they have, that brought it to light, and that's something to be done about it. And it's this board that's in place now that's getting something done, and that more importantly is gonna implement these policies going forward. Now, for once, this is something that I have painfully intimate knowledge of, going through that situation of coming up with an audit, seeing how messed up things are, and having to move forward. You guys can't fix what happened, but you can guarantee that it doesn't happen in the future. That's the best you can do, and I believe you guys are capable of doing that. So I would just like to give you some words of encouragement of, you know, it's probably moving forward is gonna be the easiest part. You know what not to do, you know what needs to be done, and you got some guys here that are quite capable of implementing it, and, you know, whatever happens, but hopefully it doesn't get blown out of proportion. You know, I believe it has nothing to do with this board or, who's running Geauga Public Health on a day-to-day basis that had anything to do with what happened. And I also believe that if it wasn't for this board or the people running on a day-to-day basis, this issue might have just been overlooked from now till any of us are long gone. So, thank you guys, keep it up.
Thank you.
Thank you.
Vicky? Go ahead. It's your turn to shine.
So I just wanted to, maybe make a little correction. I wasn't here at the last meeting, but I did watch the video and heard what I could hear from it. But anyways, there was a comment that was made, and I think Dr. Rudy brought it up, that someone had made a comment about what Mr. Moreno had said during the meeting with
HDAC.
HDAC. And I just want to kind of not correct that, but Mr. Moreno is not the only one who said that. Adam has said it, other people have said it. And it is a fact that in Geauga County, the vast majority of the work that is done by this health department is environmental health. And there were a lot of angry people that night, and I think they may have misheard or whatever. And I just want to kind of straighten it out that Mr. Moreno did not mean that the public health or the, what's the word?
Population health.
Population health is not, it's not that it's not important, it's just not as busy as environmental health, which takes the vast majority of attention needs to go to environmental health in this county. So I just kind of wanted to correct that. I don't know who spoke to you or who said it to you or whatever, but I think their tensions were high and people just didn't hear things correctly, and I don't think that's what Rich meant to say. Just wanted to correct that.
If you don't mind, I'll speak to the board. We understood that, I think in the heat of the moment, you know, percentage of staffing, percentage budget is environmental, but I would not have taken this position with GPH if they didn't believe in health, with physicians and pharmacists and IT
Right.
professionals in the health field. We know public health and population health is important.
Right.
So
And
thank you.
I understand that, I just wanted to clear up that, you
Rich appreciates
know,
it as
multiple
well.
people have said it before.
Certainly the staff appreciate it. Thank you.
Anyone else? Still waiting for Ed to say yes one day. Or his beautiful wife.
Yes, I'm ready to go.
Yeah. He motioned to adjourn.
If there's no additional public comment?
All right, I'll now entertain a motion to move into executive session to discuss pending litigation. And we'll invite Mr. Costura, Mr. Licky, and Mr. Graham. Do you need to come in too? Okay, bring you in too. So yeah, is there a motion?
So moved.
She's tired.
Okay. Roll call vote. Go ahead, this is your
Oh,
part.
sorry. Dr. Henderson.
Wake up.
Yes?
Dr. Rude.
Yes.
Mrs. Roman.
Yes.
Mrs. Berkey.
Yes. We're now into executive session at 6:41 PM.
Sorry, it's my kid's birthday today. He's got a soccer game, and so I'm eagerly awaiting updates since it's his birthday soccer game.
We're sorry.
Carolyn,
Yeah.
you have to say that you're gonna have
Oh.
action afterwards.
Oh,
What do I
yeah,
have to
so,
say?
there will be action taken, potentially action taken after executive session,
As it relates to the budget.
as relates to the budget.
I'm watching that online, sorry.
Good call.
Yeah, you can't go home.
Thanks, Ed.
He's like, wah, wah, wah.
Oh, right, right. That's right. I totally
do with community development still use, they're from their lunch table. And then they're actually buying chairs that I think are regular, because these are super uncomfortable, as you're probably finding out.
Yes.
The backs are not that great, yeah.
We need wheelie chairs.
That's what they're
Wheelie-
buying,
Okay.
yes, I
I
believe
need
that's
a
what they're
wheelie
buying.
chair.
Motivation to have a short meeting.
Yes, that is about what it is.
However, we have not had a short meeting. All right, are you ready to go?
Yep, we're on executive at 7:19.
Okay. Do we need a motion?
Yes, motion.
All right, motion to come out of executive session at 7:19 PM.
So moved.
Second.
Roll call vote.
Yes, Dr. Henderson,
Yes.
Dr. Rude,
Yes.
Ms. Roman,
Yes.
and Kevin Brady.
Yes. Okay, so we're gonna discuss the financial report.
Yes, that's the one I
What's going on
provided,
there?
I printed out a copy and gave it as we walked back in.
Okay, so tell me what the Baldwin Group is.
That is HDIS, that is Database One, as you now infamously know it as, and that is a yearly fee that we do
Okay, so
pay.
that's the yearly
Yes.
fee. Got it?
We are about done with that though, because that program, to our understanding, is being sold, it may not be supported, and so we have to move away from it, and hopefully our new Salesforce program, I can't remember the full name of it, the ACE program will be able to do what that does.
Okay. And Ferris Excavating, is that related to the
That's the,
Parkman?
no, that's Water Pollution Control Loan Fund, and that is for when someone has a septic system that needs replaced or repaired. That was replaced if I remember
Oh,
correctly.
right.
Yeah, and that's
Okay,
partially
so that's
paid
for low income,
Yep,
I gotcha. And we have grant money that was,
correct. We
Yeah,
have
marked
about
for that.
150,000 a year on average. This year's a little less, but on average we got 150.
okay. Anyone else have comments, questions?
And I apologize, that did not scan apparently with the thing, so I do a printout and copies.
No, I'm glad that they're supposed to be included, because I
Yes,
thought maybe
no,
this was a
they-
new way of doing
100%
things.
should be, it sounds like they're probably on the double side and we didn't scan the double side, so I apologize for that.
That's all right, there were a lot of papers.
Yes.
Okay, so is there a motion to approve the April 2023 financial reports?
So moved.
Second.
And is that?
Ayes and nays.
Okay, all in favor?
Aye.
Aye.
Right.
Opposed? Abstentions? Okay, the motion carries.
Mhm.
And do we have anything else we need to discuss?
It's my understanding, I will prepare a 2023 updated budget for everyone. If we have the special meeting, it'll be for that. If not, it'll be for the normal meeting. That will include, obviously, Lake County contract in it, and it will include a proposed $750,000 line item for the refunds if necessary from House bill. You will then have to make that decision. If you decide, whatever your decision is, we'll make it work based on that. But that's my understanding from what the discussion earlier tonight was that's what you'd like to see.
You're gonna use $750,000 even, or are you gonna use the
I'm-
number that came off of the?
I'm gonna assume like 850. There's 750. There's the money for the firm that would happen, and I figure I might as well put a little bit in there because it's harder to increase than it is to decrease it.
I wonder if we should run it two ways. One would include interest and one without interest.
I can talk with Mr. Kashir about that, what that interest rate would look like, because I personally don't know how.
How to calculate.
Right? Do you use the year the year it was given? Do you use today's? Is it compounding? Is it not
Yeah.
compounding? I can figure it out, but I prefer to have a I don't
Yeah,
want to throw stuff against the wall.
I think it would be helpful to see what that number could be.
Yeah. No, I can work with Mr. Kashir on that.
You are definitely including a dollar amount for the administrator that would help with.
Yes, yes.
For
My understanding
Claims
from, I have a rough
Claims
estimate of what that would be, so
administrator.
I'm using a rough estimate for that. The other thing that'll be increasing that one is our contract, not only because of Lake, but also for our fees associated with some of the audits and other things, because I can tell you, not to pat Mr. Kashura or his team on the back, Janet and Corey. Without them, it would not have gotten done in the time it did. We worked, the 1 week alone was 95 hours. We were at 120 within 9 days, and then we were working 80s after that. And that was thanks to his team, because I could have worked that for 4 straight months and probably not have gotten through everything
No,
while trying to accomplish
that's
what
very
was
much
needed
needed.
here. So this honestly, I felt as being a previous auditor, we blew through that audit. I mean, in a good way. I think they did a very good job. They were very articulate. They communicated very well. It was pleasant, if I could say that, even though the outcome.
It sounds very expensive though.
I would highly agree with that statement.
Yeah, I'm a little worried about
It
that.
was a
though.
surprise
Yeah.
to be that big.
We call it quality though. It's quality.
Okay, any further comments, questions, discussion? All right, the next, meeting, though we'll have a regular meeting on Wednesday, May 24th, 2023 at 5 PM. And we may have a special meeting, I guess, to be determined, prior to that.
Yes, I will, if you're all okay with it, I will communicate with Carolyn if we'd like to have one, and then she can make that decision, and I'll send out an invite to everybody. If we decide to have that.
All right. Meeting adjourned at 7:23 PM.
Thank you.
Yep.
Thank you.